Hi, and welcome to my channel, All Things BBL, where I go over everything related to the BBL surgery. In today's video, I'll be giving you my 6-month update. Make sure you stay to the end for a body reveal. So here's the overall on how I like my BBL surgery. Overall, I love the way my butt is. Originally, I thought I wanted a super big butt, but I do like the projection. I like the roundness of it. Dr. Fisher did a good job in sculpting it. Like he took away, like getting the BBL took away any cellulite in my butt. So that was a good thing. And I do notice when I wear certain clothes, it does look bigger, or in other clothes it will look smaller. So say for instance, when I'm at the gym in super tight pants, I do feel a little more self-conscious because it does feel bigger being in very tight leggings. And it does, create a lot of stares, which sometimes I don't feel comfortable with. So in those situations, I'm definitely glad that I didn't go super big like I thought I wanted. But like in everyday life, I'm wearing like a sweatsuit or like a dress and I'm at the supermarket, I feel just fine. Like maybe because I'm used to it now, but it doesn't feel like it's too big and it doesn't feel like it's too small. It feels like it fits my body perfectly. So that's good. The one dislike that I do, well, actually there are a few dislikes, but the main one is the back fat. I'll show you pictures. If I don't insert them here, you'll see them in the video you'll see like the video clips at the end of this video. The back fat, I still have bra fat. And after 6 months, the doctor said that the bra fat would sort of go away. He said bra fat is the most stubborn type of fat, meaning like once you have it, it is hard to get rid of. But I'm still noticing, it doesn't look as bad as it did before the surgery, but back fat is definitely there, especially when I'm like facing the back and I do like a twist. You'll see the back fat. So that part I don't like about it. I do like the way my stomach lipo, the front part of my stomach, came out very great. And wearing my faja for about 4 months, I think that helped keep the stomach flat. But what I did notice is obviously if I eat too much, like for a certain week or 2 weeks, my stomach does get a little bloated. But when I'm back on my diet and I'm not eating too late at night, I wake up and my stomach is super flat. So the lipo on my stomach helped tremendously. And as long as I keep my eating in check and keep going to the gym, everything is fine with my stomach. There's no lumps and bumps at the 6-month mark. Everything is nice and flat. There's actually some definition in the top part of my stomach. So the lipo really helped there. Another dislike is, since I got my waist, done, my thighs, my inner thighs seem to be bigger. So like my inner thighs do rub together. So I wish I would have gotten inner thigh lipo. I think I said in my other video, when you're heavy all over, you don't notice just one specific part, meaning like my thighs. But once the waist and the back was lipoed, my leg fat is noticeable more. So when I walk, it gets like a little sweaty up in my inner thigh area. So I wish I would have gotten that done. Now, would I ever do a round 2? I would do a round 2 because I would want him to focus solely on my back fat, and then I would probably throw in the thigh lipo. Thigh lipo, I heard it doesn't really hurt as much as like the stomach and the back lipo, so I would add that in. And of course, if you wanted to do something on the front of my stomach, I could always use extra taken off. But I don't plan to do anything anytime soon. I do want to have a child first before I go back in for another procedure. So maybe in another year, I would definitely go, but I would go back to Dr. Fisher because he is amazing and I just love his results. But I would definitely add in inner thigh lipo. Oh, and also another, it's not a dislike, but I'm getting used to it now, but when you do get lipo, you can also ask him to lipo your private area, because think about it, when you gain weight, your private area also gains weight. So after they take out the fat in your stomach, they do not lipo like your private area, like in the front part, unless you specifically ask for that, and then I guess there's another charge. So once your stomach is super flat, you'll notice that your private area just seems fatter because that fat wasn't taken out. So I wish I would have known that. Maybe I would have had them also lipo the fat in my private area. But I've gotten used to it, and it has gone down since, like, you know, after a month out of surgery, 2 months out of surgery, it seemed very fat in my private area. But now after 6 months, it's maybe I'm used to it, but it doesn't seem as bad. But that's something to think about. Think about the private area lipo, and definitely think about getting your inner thigh lipo. And so at the 6 month mark, when it comes to sitting, I still use a boppy pillow if I'm sitting in a chair, or when I'm driving, I still take my boppy pillow and use it for the car. I'll insert a picture here of the boppy pillow. And I still sleep on my stomach. And when I'm watching TV, I'll still like watch TV on my stomach, or I'll lay on my side, which feels fine. Since my hip lipo, you know, the hip lipo went away after a month, so I'm not worried about laying on my hips because there's no fat there to damage. But even at the 6 month mark, you would be okay to damage it because it's, you know, it's in place at 6 months. So I do lay on my side a lot, but I won't lay on my back like in bed. It just doesn't feel comfortable. It still feels like a balloon. Not like painful if I'm laying on it. It just feels funny. It feels like I'm raised up and like something's gonna pop. So it just feels uncomfortable. So I just stay on my stomach in bed or lay on my side. And now, like, I've taken road trips maybe up to 5 hours, but I've been sitting on my boppy. Now I have been at places where I can't take the boppy pillow, and like I've sat for maybe an hour straight, and it's very uncomfortable. Like after that hour, like I just start fidgeting because it starts hurting. Like your butt starts to feel sore sitting on a regular seat without a cushion. At the 6 month mark, like for me, for an hour, I just can't do that. So I just take my boppy pillow everywhere still, and I actually still use the toilet seat riser. I'll put a picture in here of that. I don't know, I guess I'm just so paranoid about the fat staying in place, even though scientifically, you know, the fat is where it's gonna be, and I'm not gonna smush it anyway or make it go away. Just mentally, I just feel better in my head of, you know, using the toilet seat riser and still using the boppy pillow. But normally at 6 months, people don't use the toilet seat riser. They'll just sit on the toilet regular. But I do have a lot of friends who still use their boppy pillow even after 6 months. I guess it just depends on how you're healing and how your butt feels. But probably the longer that I'm waiting to like actually sit down on it, like without using the pillow, I'm sure that's making not my healing go by slow, but I'm sure it's just making me not feel comfortable with it because I'm not giving my body a chance to get used to sitting on a regular surface without a pillow, if that makes sense. So that's how it is at 6 months with sitting. So now when it comes to faja, I stopped wearing my faja at the 4 month mark. You know, the faja helped tremendously within like the month 1 to 3, keeping my stomach flat, and it just helps mold your stomach back into a flat position, because after you get lipo, you know, you have a lot of lumps and bumps, and that faja really just sucks you in, smushes everything down, and puts everything back into place, so to speak. So it's molding your stomach back to be flat. So I noticed after month 4, I didn't need to wear my faja for my stomach because my stomach had no more lumps and bumps, and my stomach was staying flat without it. Like I would go maybe, 3 to 4 days at first without my faja, and I just noticed my stomach still looked tight, still looked flat without it. So I ditched the faja at the 4 month mark, and I did notice also, I think, mentally, or I don't know if this is true or not, but after wearing the faja, my butt seemed to soften up. The faja was great at keeping my butt, I believe, perky, because it supports the lower part of your butt to keep it upright, like to keep it perky. So I think once I ditched the faja, my butt softened up, but it did still stay perky. I don't know if that's due to time, maybe just because I'm at the 6 month mark, my butt would have been softened up even though I was still in a faja, but the faja does keep the butt tight and upright and just perky. So I don't know if that's what happened. You know, at the 4-month mark with the faja, you know, I'm not wearing it anymore. For my situation, like if I wanted to, I could have started waist training at month 4, you know, like with latex waist trainers, like the ones with the rods, like the super high compression. I believe I could have started then if I wanted to, but I don't like waist training. I find it annoying, and I just find eating less keeps my stomach flat and tight and going to the gym. So that's about it with the faja. Thank goodness after 4 months I can get rid of that thing, because it does get annoying wearing it, especially like when you're in your stage 2 faja, you have to take it off when you go to the bathroom, like when you go number 2, so that's annoying. And just the fact that there are so many clothes that you can't wear with the faja because you can just see it through the clothing. I think I'm gonna do another video on like the type of clothes that I wore like during like when I had my faja on and what clothes look good with it. But I'm just glad I don't have to worry about that. And just being sucked in, because I would wear it 24/7. So even like sleeping, I'm so glad I don't have to deal with that, you know, tightness and just that compression during sleep. So yes, at month 4, I stopped. And so when it comes to softness and pain, like the softness, my butt has softened up. So like when I do walk, it will shift, the whole thing will shift, like boom, 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 but it doesn't jiggle. So it's not so soft yet at the 6-month mark that it jiggles. For me, I know some women, they get the jiggle like after 3 months, but mine softened up, but it's not squishy, squishy. And when it comes to pain at 6 months, you know, you're not gonna, well for me, I don't have any stiffness anywhere, nothing. My stomach feels back to normal. It doesn't feel icky to touch it. My back is completely normal, it doesn't hurt. And the butt just feels fine. So everything at 6 months, you feel back to normal. There shouldn't be any stiffness, there shouldn't be any pain, and there shouldn't be any more lumps and bumps. I don't massage anymore. I think I stopped massaging after the 3rd month. So at 6 months, there's no lumps and bumps. There's nothing to massage. It's like your body really goes back to normal, or it's in its normal state by the 6-month mark. So you can really determine if you have any complications. Like if you're still having issues at 6 months, there's something wrong, and you should definitely go back to your doctor. And so I'll show you, like, these are one of my favorite dresses that I love to wear. This dress, like, you could, if you're still wearing your faja, you can actually wear your faja and it won't show through this type of dress. I'll leave the link. I got it on Amazon. These are a size medium. I like how it has pockets and it also has a tie. So if you have your faja on underneath this, your waist will look very tiny. But I'll show you how, like, it just, you know, from the side, I don't know if you can see the projection of my butt. It looks nice, like it just looks really good. And if I'm walking, I don't know if you can see, that it moves or not. But yeah, these are my favorite dresses. I bought them like in every color. So in this next clip, it's a video of my body reveal at 6 months. I'm sorry I didn't take it in landscape. I took it horizontally, but hopefully you get the picture and can see the results. So here is my 6-month update for the 2 scars that are in my lower pubic area. They have gotten lighter, but they haven't gone away completely. I did stop using the scar cream at month 4 because after 4 months, you know, the scar is just gonna stay there, but it's very faint, you know, and you could barely see it. It's in your pubic area. Then there's 2 scars on my upper butt area. Those also got lightened up. They just look like marks, like 2 marks, but you really have to look hard to see it. And then there's a scar in the crack of my butt. That one has seemed to heal, raise, so it feels like a little bump in the crack of my butt. And then the scar in the upper part of my back, that healed the best. You can't really tell. So here's my 6-month update. I've been trying to, you know, exercise and eat a little healthy. My stomach is, you know, it's staying a little flat. It could be flatter. I haven't been wearing my faja since month 5. I stopped waist training. I stopped wearing my faja at month 5. So I'll do some turns here at the front. And then you got the back. And it has softened up. Like I can like jiggle it a little bit. It does jiggle a little bit, but it's still pretty, it's firm. My butt is still very firm. But I think, you know, I'll let me do my turns first. And then back to the front. So I think with it not, with it getting softer, I think it's because I haven't been wearing the faja. You know, the faja tends to keep the butt upright and tight. So I think by not wearing the faja for the past, you know, since month 5, it helps soften it up. I still don't sit on my butt directly. I still use a boppy pillow, and I still sleep on my stomach. But I like how it's softened up a little bit, enough to like do a little jiggle, but then enough to like stay firm, looking like it looks like I work out or something. And the one thing I don't like about it is, I think I've been complaining about this the whole 6 months, is the back rolls that are still there. So like when I'm facing this way and I do a twist, we still got these back bra fat rolls. And the doctor said at 6 months it would go away, but they haven't. Like first the doctor said, you know, they would go away at 6 months. Then the doctor said that, you know, once you have bra rolls, it's really hard to get rid of them because the skin gets very loose and you just have to diet to get rid of it. So I've been trying to eat healthy, but I haven't been eating that healthy. I do eat a lot of sweets. So the back rolls have just stayed. See? So they stay. They're here. They haven't gone down. I guess if I show you my before video, I'm sure you'll see a difference. But if I was to get it done again, I would have them aggressively go in throughout from here, you know, from here on up. I would have them aggressively try and get rid of that fat, because it's more than loose skin, it's actually fat. So that's the one thing that I don't like about it. And the doctor did like send me a 6-month email update. I haven't gotten back to them yet, but I'm gonna let them know how I don't like the sides. Bra roll still being there. It's annoying. And so in these next clips, I'll just be showing you some pictures and how my butt looks like when I'm in shorts, when I'm like wearing a thong. I don't know the order that I'm gonna put these in, but I'll just flash some of these. These were all like at the 6-month mark, and you can see the roundness. And you know, like I said in my other video, my hips did go away like after the 1st month. So, you know, my body does still look narrow, but I'm definitely liking the results. And you know, you can see from some of these pictures of me in clothes, sometimes it looks bigger than others. So that's always something to take into consideration when you're getting it. You can hide it if you want, or you can display it and show it off. And if you want to see my other monthly updates, check out these videos. I'll try and link them either here or here, but I'll also link them in the description below. And make sure you subscribe.